Small Business Majority appreciates this opportunity to present the small business perspective on the House Tri-Committee Draft Healthcare Reform Plan. We support the effort to move this legislation through the Congress expeditiously, and thank you for bringing this forward in a timely manner. Small Business Majority is a nonprofit, nonpartisan organization founded and run by small business owners and focused on solving our biggest problem that we face today, the skyrocketing cost of health care. We represent the 27 million Americans who are self-employed or own businesses of up to 100 employees. Our organization uses scientific research to understand and represent the interests of all small businesses. I've been an entrepreneur for more than 20 years, including 12 years owning and managing an internet communications company. Together with the other senior managers in our organization, we have a total of 70 years running successful small businesses ranging from high-tech to food production to retail. We hear stories every day from small business owners who can't get affordable coverage. Louise Hardaway, a would-be entrepreneur in Nashville, Tennessee, had to abandon her business dream after just a few months because she couldn't get decent coverage. One company quoted her a $13,000 monthly premium. Others, such as Larry Pearson, owner of a mail-order bakery in Santa Cruz, California, struggle to do the right thing and provide health care coverage. Larry notes that, quote, "The tremendous downside to being uninsured can be instant poverty and bankruptcy. That's not something my employees deserve." Our polling confirms that controlling health costs is small business owners' #1 concern. Indeed, on average, we pay more than 18% more for health care coverage than big businesses. An economic study that we released earlier this month, based upon research by noted MIT economist Jonathan Gruber, found that without reform, healthcare will cost small businesses $2.4 trillion over the next 10 years. As such, we are pleased to see that the House bill addresses key cost containment measures, such as expanded use of health IT, transparency, prevention, primary care, and chronic disease management. Our polling shows that 80% of small business owners believe that the key to controlling costs is a marketplace where there's healthy competition. To this end, there must be an insurance exchange that is well-designed and robust. We are very pleased that the committee's bill proposes a national insurance marketplace with the option for state or regional exchanges that adhere to national rules. Moreover, we're encouraged by the committee's proposal that there be standardized benefit packages along with guaranteed coverage without regard to pre-existing conditions or health status, a cap on premiums and out-of-pocket costs, and marketplace transparency. We understand that a balanced set of reforms will require everyone to participate. 66% of small business owners in our recent polls in 16 states, for which we're releasing preliminary data today, support the idea that the responsibility for financing a healthcare system should be shared among individuals, employers, providers, and government. It should be noted that respondents to our surveys included an average of 17% more Republicans than Democrats, 40% to 23%, while 28% identified as independent. According to the results of the economic modeling done for us by Professor Gruber, comprehensive reform that includes even modest cost containment measures and a well-designed structure of employer responsibility will offer a vast improvement over the status quo. A system with appropriate levels of tax credits, sliding scales, and exclusions will give small businesses the relief they need, potentially saving us as much as $855 billion over the next 10 years, reducing lost wages by up to $339 billion, and in response to the question that the ranking member asked Dr. Romer, minimizing job losses up to 72%. We are very pleased that the committees have addressed some of the affordability concerns of the smallest businesses. Professor Gruber has modeled specific scenarios described in detail in our report, and we look forward to working with you to ensure the best balance between the need to finance the system and our ability to pay. Finally, another issue of great concern to us is the unfair tax treatment of the 21 million self-employed Americans. Under the current tax code, self-employed individuals are unable to deduct premiums as a business expense and are required to pay an additional 15.3% self-employment tax on their health care costs. We encourage that this inequity be rectified in the final bill passed by the House. Chairman Miller, when you announced this historic bill, you noted that healthcare premiums had spiraled out of control, quote, placing our fiscal future in peril. As small business owners, we agree wholeheartedly. Healthcare reform is not an ideological issue, it's an economic and practical one. We are encouraged by the overall approach of this bill and look forward to working with you to make it a reality this year. Thank you.